many of the countries Brac operates that we've seen in Europe, China, the US is now starting to happen in parts of South Asia and Africa as well. But even if the health impact is only now, already we've seen the market impact and the economic impact. Huge withdrawal during March of investment flows from developing countries. Commodity prices down 30%. The real economies of all the countries in which we're operating hit really hard, with export sectors like garments and cut flowers closed, remittance earnings way down as remittance workers go home, and above all, the economic lockdown, the preventive steps that so many governments have taken, the stay-at-home policies, which inevitably have stopped these economies and particularly hit the Brac caseload, the poor and the vulnerable. So today we're going to hear about the situation, but we're also going to hear about how it's not just a repeat of what's happened in the West and in China. These are countries which in some ways are used to having communicable disease as part of the fabric of life, malaria, pneumonia, Ebola and HIV, and countries which have built systems for responding to that, which have a resilience that may not always be found in the West. Countries which on the economic side have developed systems like microfinance, Brac's own 40, but government-based cash transfer schemes, which are in many ways much more sophisticated at targeting the poor than the welfare systems in the US and Europe. You don't need to write a check with the president's signature on it to get money into the hands of the poor. We've got quite efficient tools available to us. So, what we don't know how the health pandemic will play out. We pray it won't be as serious as it was in the West. But I think what we can conclude is at the very least, the economic crisis will drive hundreds of millions of people back down into poverty and will be with us for quite a long while to come. So whether it is a health and economic crisis or just an economic crisis, Brac anticipates being at the center of the storm for a long while yet. So with those introductory remarks, I'm going to first ask Asif if he would tell us what the biggest frontline challenge is in responding to the COVID crisis right now in Bangladesh. And then Musa will follow straight after with the international, and then Hasina, sorry, I misspoke. Hasina will go next with the Cox's Bazaar and Humanitarian, and then Musa will turn to the international. Asif, the floor is yours.
Thank you so much, Mark. You have basically nailed it in terms of your description on how things are different on this part of the world. Just to give you an idea in terms of where we are in Bangladesh. Bangladesh's first confirmed case came in on March 8th, even though the unconfirmed sources are that we actually have been having this a while ago, but the testing has been very, very slow in Bangladesh, and it's been very, very centralized for a long time. So it has been only recently been ramped up in the last few days. So as the testing has been ramped up across the country, now the numbers have started jumping quite alarmingly, and we have now almost on average we have a spike of 200 to 300 people who are confirmed cases today. For example, 261 people were confirmed and about 15 people died. But the worry is that there are many sort of cases who have not been tested. So we are not quite sure where we are on the infection curve. So there is huge sort of push in terms of from the government side right now to ramp up testing, but at the same time, there's capacity shortage. And at the same time, there's never gonna be enough testing that the government will be able to do for a country like Bangladesh, which is just for the viewers, it's extremely densely populated. It's resource constrained. Just to give you an idea, it's about half the population of the US packed into the New York State, size of New York State. That's how densely populated Bangladesh is. And so in a country like this, it's extremely difficult to get a lot of this testing done. But on top of this, The lack of being able to do proper contact tracing, not being able to enforce social distancing has been a major issue. Um, so that is one of the biggest challenges on the front line. But at the same time, we are in a economic shutdown mode since March 26th. So we are almost a month. We're heading towards a month that we are going to be completely shut down, and this is very different from the global north shutdown because um, 90% of the economy is informal. That's the luxury of working from home is not quite there. So as a result, a lot of these people who are daily wage laborers, informal workers in various different sectors, they are completely jobless. Small business is shattered. Our recent survey showed that we have uh, so the annual sort of the daily earning of an average family has declined by almost 75%. And these families don't have savings. So we are looking at a very, very sort of long, protracted economic crisis and humanitarian crisis for a vast number of population. So for us, the challenge is now twofold. One on the public health side, to ensure that we are actually being able to test, contact trace, and sort of keep it grouped in a hotspots and contained. And on the other hand, mitigate and manage this economic and humanitarian crisis at the same time. So I'll talk a little bit about what Brac is doing later on in Bangladesh. Let's hear from others.
So in Cox's Bazar, as you know, that we have two scenarios. One is for the host communities and another in the camps for the Rohingya communities. Naturally, the impact or the challenges in the host community, as Asif has mentioned, like other part of Bangladesh is pretty the same. The hard economic loss of the host communities, together with the awareness on social distancing and the preventive measures. In the Rohingya camps, it's mostly the social distancing because it's very densely populated area. People live in a very...
Snap up microphone to Shamnan.
Can you hear me now?
Yeah, microphone to Shamnan.
Yeah.
Microphone. Yeah.
So that is the twofold challenges here. One for host community, as I was telling, that is not much very different as Asif has mentioned about the other part of Bangladesh. And for the Rohingya camps, it is mostly the social distancing because it is a very densely populated area. And it is virtually impossible to maintain social distance even in their households. Of course, we are trying to make sure that all the service that we still are providing as a critical essential services, as you might know that 5 critical essential services we are still continuing in the camps. Those are food distribution, health, wash, site management, and protection. So we are trying to maintain all the recommended measures that we can in the service providing kiosk and the stops. But at home, I mean, that is a real time challenge. But also another challenge for the host communities, the agricultural income loss, as Asif has said, that informal economy. So that is going to be a huge thing for the this part of the country as well. And for the Rohingya communities, there will be long-term impact challenges. At this moment, we are continuing the critical essential support service for sure, but then other services like education facilities, mental health and psychosocial facilities, some sort of skill development, those are suspended right now for valid reason. But that we are thinking that it will eventually have a longer term negative impact on the community itself. And also the vulnerable communities, like vulnerable minority population segment of these Rohingya communities, like children and women. the gender-based violence, we apprehend that it's going to be increased a lot, and the trauma that the population is going to face will be huge, especially if you look at the reproductive role of the women who are at home. They are now confined at home, and yet they have to do, I mean, every single activities that they have to do. And how do they maintain all the social distancing, at the same time all the preventive measures? Though we have been trying to support them with information sharing, with letting them know, making sure that they do understand that what does social distancing and preventive measures, particularly hand washing, means, providing not only the information but also equipment like soaps and hand washing stations, masks and gloves where necessary. We are continuing, but the situation is still fluid, to be very honest. So we are also in consultation and in coordination with the wider framework of the humanitarian agency here in Cox's Bazar, and all together, that's what we are right now continuing. Over to you.
No, thank you. I'll be speaking a little bit about the countries where Brac is working outside of Bangladesh, managed by Brac International. We are working in 10 countries in Asia and Africa, 6 in Africa, 4 in Asia. And the situation vis-a-vis this COVID outbreak, COVID-19 outbreak, is very different in different countries. Some of the countries like Philippines, Afghanistan, we see the disease has been progressing quite fast and they are picking up. Not yet there, but getting there. Some of the countries, on the other hand, like Sierra Leone, Liberia, and even in Tanzania, we're seeing that disease is just starting to break out. So therefore, the preparations and responses in different countries are also diverse. And so altogether, we saw until recently, there are more than 6,500 cases identified and more than 350 to 400 deaths, but that's just the beginning. Since Mark, you asked me to highlight top line summary challenges, I'll just list 4. Number 1, we are seeing the challenges that could be categorized as public health interventions focused on COVID-19 outbreak. That includes like even ability of the communities to adopt some of the messages we are giving, some of the recommendations we're making. And it goes beyond awareness to really be able to afford soaps, afford water. At the same time, at the clinical level, ability of the hospitals to respond to that. I'm not going to detail, that's one. Number 2, the challenges of food insecurity, income insecurity, which we have been discussing at household level. Brac International, we have been undertaking a rapid assessment just 2.5 weeks ago to see what is happening in the households when people are under lockdown in most of the countries. And we found out already in the first week of April, more than 30% of the people are beginning to really respond differently within their household to the food shortages, cutting down the meals, having less food. And we are beginning to see that that was affecting mostly women and girl childs most, because they eat last and least. Third challenge is the challenge that is, you can say public health, but it's unique in nature. Challenge of psychosocial nature, where we are beginning to see that people at the community level are gradually becoming hopeless. They are kind of concerned. Some of them are getting into depressed mode, and some of them are getting angry. They're hungry and angry. As a result, there is a potential that there could be outbreak in various forms. That need to be addressed. And the fourth one, and the last one I for now mention, we are seeing countries after countries inadequate capacity inside the country to address these challenges from all perspectives, be it public health, like hospital preparation, or be it food insecurity or income insecurity. So the government as well as local institutions are not adequately prepared to handle the challenges that is coming up. The windows are closing. We are concerned about that. We need to address all of those. Let me stop here.
Thanks very much, Musa Bhai. Asif, we I think already established that one size doesn't fit all in terms of lockdowns and social distancing. So it'd be great if you could talk about the particular context of Bangladesh. But as you do so, just give us also a sense of the sheer scope of Brac's operations against COVID in Bangladesh. I mean, you are in Bangladesh the big civil society players. And I just want to make sure everybody's aware of the size of what you're doing. Asif, you're muted.
Apologies. Thanks, Mark. So yes, I mean, in a sense, when we started preparing, our first focus was that let's get all of our staff and our clients in a safe space. So first few days we spent ensuring PPEs going to our staff, ensuring that our washing stations are there. We have about 4,000 offices. We have close to 45,000 full-time staff. With teachers and others, we have close to 120,000 workers and also 50,000 community healthcare volunteers as well across the country. And if you look at our clients, there are about close to 7 million microfinance borrowers who come to our offices in various times. So our first job was to protect them. Then we figured out that, like Musa bhai said, that essentially for a country like Bangladesh with a very weak healthcare system, prevention would be the best cure for us. So we needed to get the word out as fast as possible to get people understand what this is. Go with the behavioral change messages around hand washing, hygiene around sneezing and coughing, and also the social distancing. So we went, over the next 2 weeks, we went door to door to about 24.5 million households. 5 million people in about 5 million households just through our community healthcare workers. And then we basically also started a massive media campaign in radio, television, social media, which blanketed the airwaves to reach even more people, and through miking and others. So we had a very online and offline work, and we wanted to reach out to as many people in the country as possible in a very short amount of time. Then the economic shutdown started, and we also started evolving our work. So one sort of work started around economic sort of support that was needed in a very quick time. So we started mobilizing funds as well, and we also launched a big emergency cash transfer program to about 100,000 households. That completed last week. We just launched a second phase of that to add another 100,000 households to get cash transfers. And we are reaching the most marginalized, hard to reach areas and these urban poor that I talked about, essentially. And, but still the needs are much, much greater. And obviously, government is also mobilizing resources, but the biggest challenge in countries like ours is that the targeting. Essentially, we don't have a very strong targeting mechanism for the government, neither from the social sector as well, where we can just go out and articulate and target people to get these transfers that are needed. So that has become a bit of a big challenge, because unless these things are very uniquely tied, because unless you can ensure that people are not starving, you can't keep people inside their homes. They're going to come out. So essentially, it's not just about the economic crisis. It's also about how you're actually supporting to mitigate the public health disaster so that they don't come out of their houses. So that's becoming more of a bigger challenge now than anything else. And something that I wrote about in the past has been that policymakers are also struggling in terms of how do we sort of keep the livelihoods, protect the livelihoods, and at the same time protect the lives of the people. So essentially that means that they also don't have enough sort of models in front of them which actually works for them. Say for example, in Bangladesh, you have a very young population and also a very densely populated country with a lot of urban slums in place where it's extremely densely populated. And then sort of the public healthcare system is very, very poor. So essentially, all these models that we see that are currently out there, which supports the policymakers to implement these kinds of shutdown, is very much driven by the sort of the benefit and in the public health sector that's going to be coming out of this in the global West. So there is not enough model, and Yale University professor Mushfiq Mubarak recently has written about it. So it's not that we are saying that social distance is not needed. It's absolutely needed, but essentially we need to have a clear idea in terms of how to enforce that based on local context and local sort of realization. But at the same time, there needs to be a strong stimulus package that needs to come in hand to ensure that social distance can be enforced. And also the sort of the larger economic fallout and the fallout in terms of loss of livelihoods of people and the food insecurity that this is causing. How does that compare to the other sort of challenges that are out there? That needs to be measured very, very closely. And so we going forward, we also need to start, have a better idea in terms of where we are on the infection curve, we need to start planning very, very specifically on how to gradually open the economy up, but maintaining the social distances at the same time. So there needs to be very specific sort of approach. And I think SOPs, one of my colleagues have recently written about it, is that, now the garments factories are closed down. So how long are they going to be closed? So when they open up, they need to have a very specific SOP to open the garments factories where proper risk mitigation is in place. Similarly, we need to look at the domestic workers. We need to look at the rickshaw pullers. How we are going to enforce this when life opens up. We need to plan that based on our sort of understanding and knowledge. Thank you. Now you're on mute, Mark.
Musa Bhai, thanks, Asif. Very quickly, if you would, just give us a sense of how your 10 countries, both the contrasts within them and the contrasts between them and Bangladesh.
No, thank you.
I think programs.
So I take your question as kind of two components. One is, so how is Brac responding in 10 countries? But you also asked earlier, does one size fits all? So let me start the second one. The answer is no, of course not. The countries, as I mentioned, countries are very different. They're geographically, culturally, politically, institutionally. So therefore, we have to really adapt to the local situation. Now, something we know are common. For example, building on what Asif Bhai was saying, that we now know what has been working in coronavirus outbreak in some of the countries who dealt with it. We know that a combination of approaches like social distancing package, identify right intervention from that package. Number 2, the hand hygiene, hand washing properly. And number 3, surface to person contact prevention. So that if you work on those collectively and tune it in the way that can be adopted in local situation, then you are likely to get higher level of result. Now, one thing that our founder of Brac, he taught us that when you go to a country with some intervention package, don't just go and implant it. You go and begin by learning that country's culture, that country's effort, that country's knowledge, their way of they deal with their kind of challenges. So in this particular case, we also did the same thing. Building on Sir Fazl Hasan Abed's teaching, we first began in the 10 countries by undertaking a rapid assessment. Rapid assessment to understand what is the situation in each of the countries. In the first week of April, we took rapid assessment, how they're responding. But we also had the knowledge of what are the ongoing in-country capacities, coping capability, institutional capability, cultural capability, the way they deal with, what are those? And how do we really take this scientific intervention that I was just describing and introduce those in a way that they match together? Now, just to give an example, like countries in West Africa, people dealt with Ebola. Now, Ebola is different than COVID-19 outbreak, but there are practices done there could be drawn on. They practiced social distancing at that time. 7 months they were out, and there are a lot of lessons to learn. How do we build on that kind of thing? People dealt with HIV outbreak in East Africa. People dealt with malaria-related even endemic situation. So we first have been learning through assessment. This assessment would be undertaken every 3 to 4 weeks so that we continuously learn. not just quantitative data we are collecting, but also qualitative data. Based on that, we developed a four-pronged strategy. The strategy, first one is that, yes, ensures staff safety, security, and safeguarding while they're responding. Number two, raise awareness among community about this problem, but also help them learn the different prevention management techniques and give them the resources to do it. At the same time, also ensure that you are dealing with their food and income insecurity issues. Number three, partner and build coalition with others so that you can respond together, complement the effort of others at the community level. And number four, really work on economic and social rehabilitation. So these four-pronged strategies are being adopted in each of the countries, and together there's one common thing, that is common lesson, that you need to do psychosocial counseling as appropriate to different communities that's going on. So this is the answer to your question, how Brac is responding. We have in the 10 countries, we have now reached more than 28 million people in the 10 countries outside of Bangladesh through these interventions. But one key thing, and that includes food distribution, what we had started in Liberia, but important thing is that we are doing in coalition with others. For example, in Afghanistan, 5 organizations together, we built a coalition, and our WFP, World Food Program, is channeling food through this coalition. In Liberia, we are collectively leading this safeguarding in this situation, where Brac is leading 4 organizations, something called Liberian INGO Association. So we are doing in partnership and coalition. That's our approach. Let me stop.
Great, thanks very much, Musa. Hasina, Cox's Bazar is about as crowded as it gets, more crowded even than Dakar. A British journalist today wrote rather breathlessly that it's several times more crowded than the Diamond Princess, the ocean liner which got so many people got sick on. So how, in what is also a refugee camp with quite a lot of security to prevent people spreading out, how on earth are you dealing with issues like social distancing there?
Yeah, thank you. Yes, that's as I have mentioned, that it's really, I mean, the top line priority at the same time challenge as well. And all the 5 critical essential sectors that is still continuing even under this lockdown situation in Cox's Bazar, Brac is implementing all those for critical essential services. So we have to continue. We cannot stop servicing communities, yet we need to ensure the staff's safety first. So we did orient and trained our staffs in terms of the preventive measures, and we also equip them equally with masks and gloves and I mean all sort of PPEs, hand sanitizer. And as you know, that all the 11 health posts that we run inside the camps, they are still running. All our 3 primary healthcare clinics are still running, and we do their like normal delivery as well. So that those things are have to continue. And at the same time, the dense population there, I mean, how do we make them understand the importance and the principles of social distancing and the preventive measures like hand washing? We have been trying to reaching out to them in the camps, preparing leaflet and poster in their own language. We have activated our volunteer network there. In the camps, Brac has more than 4,000 volunteers. They are Rohingya volunteers. And we have diverted our volunteers from all the suspended activities like education and few others. So we train them, we orient them, and we have used them so that they can reach out door to door to tell people about the social distancing and hand washing safety measures. We also activated the CHW, the Community Health Worker Network. We have them in the host community. So they are also equally activated and trained and equipped, I would say. We have also tried to use the local elites like within the camps, like the imams and the lady imams, they call Hafiza, so that people do listen to them. So they even our staff, they gone a little bit of innovative intervention, like they did small video clips, you know, of the imams in the Rohingya language, and they did use it for audio distribution, like with megaphone and miking, so that people do listen. And we had to do it, and we have been doing it time and again because people do forget. Another thing is that installing hand washing devices is not enough. We have to ensure supplying the running water and the soaps. That we have been doing throughout. And there we also coordinating with other agencies who are working in the camps. Brac is even supporting other agencies, even tracking water from 25 kilometers far, so that these hand washing devices are active. And not only the communities, we also trying to provide support as much as we can to the local administration, like law and enforcement department. In the checkpoints, we installed hand washing devices. We also kind of orient them. We provided some kind of PPEs and hand washing soaps, hand sanitizer as much as we can. But as I have said, that it is a challenge, because now you cannot gather people, and it has to be done door to door. Monitoring even is a challenge, because in the camps there is no mobile network works. So, but all our information hubs, we are still running it with one person at a time. We have started rotating our staff so that we do not expose everybody at a time. But we are trying our level best, as I have said, that as much as we can. Luckily, I can say there is no reported case yet in the camp. Only 38 suspected cases are in institutionalized isolation center. And even in Cox's Bazar, there was one who has recovered. So that's how we are doing here in Cox's Bazar, to reach out to people and make sure that they do understand and follow the instruction. Thank you.
Hasina, thank you very much. I mean, everybody who knows Brac and loves Brac knows that it's two things. One, learns from its beneficiaries with an incredible feedback loop to improve what it does. And secondly, is a tremendous innovator, both low-tech, community-based solutions, but also much higher tech solutions, drawing on the emerging sort of software of Bangladesh, et cetera. So perhaps Asif first, and then, or sorry, Musa first, and then Asif, you could just give us a sense very quickly of the innovations that you're seeing happening in the programs around COVID. Musa, bye first.
Digital play lab. So let me explain what it is. Or radio-based play labs. So play labs are something we innovated when we started working in Rohingya refugee camp. What was it? We were learning at the time that while in the first 1 or 2 months, refugees were coming in, everybody was busy with food, water, toilets, everything. There were children who are suffering psychologically, health-wise, as well as in various other dimensions, and nobody is paying attention to them. There were child-friendly spaces, but they were designed in a particular way that served the purpose of very big group of people, but not a small group of people. At that time, we have a leadership team, a strong leadership team within Brac family, who went out and discovered that these children would be better served if we bring them in a small group, help and discover what are their own culture-specific games, culture-specific rhymes, culture-specific toys with which they used to play. And if you can really build on their own games, own rhymes, own songs, own drawings, and bring them together, then you can really help them play with those, sing with those, and feel healed, as well as learn, as well as feel relaxed. Based on that learning, and it was very impactful, we actually ran more than 225 similar play lab stations in the first year of the Rohingya refugee places. Now, in this situation, we thought we need to run similar play labs, especially when children are at their home. But can we do it when they need to be socially distant? They need to be isolated. So we are coming up with an idea in collaboration with Lego Foundation that will be running digital play lab, by which songs, musics, rhymes that are locally adoptable, that are locally grown, will take them and use those through the play leaders in the communities where they are. They have the mobile devices, and we have all those in our kind of mapping system, and we'll be using those to really make sure that children still have opportunities to play, feel good, and feel healed, feel relaxed, feel hopeful. At the same time, they learn and grow. So that's one of the examples I've given. Similarly, there are many other innovations that you just mentioned that Brac is about innovation. It's how about innovative ways of disseminating messages at a time when you cannot really go and create gatherings in Africa, for example. Whereas in African culture is about coming together. We are using something, a culturally appropriate method we call jingle. Jingle is a locally based drama system. We're bringing those in radio. And therefore radio jingle is kind of being done in, for example, in countries like Uganda. Hasina is here who worked in Uganda. Sorry, I was talking about Liberia. Hasina is here who worked in Uganda. We're using Boda Boda, which is a kind of special local means to really transmit messages. So a number of ways. What we are not doing now in terms of innovation, that for example, Brac's usual mode of innovations are you start from ideation jointly with the communities, you innovate with the communities. Jointly with, you go for ideation to prototype development, to testing, to piloting, and then do some study to validate it, and then go for scaling. We are not doing that at this time. Our principle here is build the plane as you fly, because this is the time when the crisis is there. That's the approach we are taking now.
Asif.
Thank you. First of all, I think we are operating now at a very different mode, at a humanitarian operation mode, and amazing things are happening as innovations are coming in from our field staff. Also, partnerships are emerging very quickly with different actors. So I want to thank our strategic partners, DFID and DFAT Australia and Global Affairs Canada, who also quickly sort of mobilized some funds for us to do some of these work that we wanted to do along with our own funding. So they have been very, very supportive. There are fantastic, unique partnerships that are emerging with the government, for example. The government in Bangladesh has switched to television for teaching education from grade 6 to grade 10, and brought in Brac as a partner to develop the learning material and the content for these TV-based education media. So this is a fantastic partnership and innovation that is happening on the ground. For the sort of primary school, we are now talking about a phone-based education model so that we can reduce the learning loss. It's not going to be obviously at par with what would have happened when the kids were at school, but it's actually going to help people to keep them engaged. We're doing these through 20-minute phone calls. Teachers and students are talking to each other, because we are operating in a world where you don't have smartphones as well. So we're talking about this very poor population who would come to our school. Similarly, in a sense, our microfinance workers are going out and coming up with their own sort of solutions. In a sense, for example, usually there are a lot of congregation that happens in front of tea stalls. So they're drawing chalk circles in front of all the tea stalls to space people up so that people actually stand at a distance. So that seems to be working in some of changing behaviors, reminding people that they're not supposed to congregate. As I was mentioning, that on top of that, we have brought in very popular folk stars in Bangladesh to do some of these messages in local dialects and folk languages. So that has been very, very effective. Similarly, we are doing some sort of digital stuff as well that has been quite effective as well. So we have come forward with the Corona Check app. It's almost like a pre-screening app that people can use going to our website or from a phone to kind of answer a few questions and see whether they are high risk of corona. We are also looking at ourselves as a partner or a platform of innovators and other organizations who can come and work with us. A local engineer, young guy who started working with 3D printers in a fab lab, is developing 2,000 shields for our doctors in Bangladesh. So we are procuring that. We have opened up our entire data set for urban slums in Bangladesh to ensure that there's coordination in terms of all the voluntary and NGO organizations who are providing relief work. So there's a coordination tool, so we can go identify a slum in a map and see how many households have been covered by which NGO or voluntary organization, and plan which ones are excluded and go there. So that is also being quite effective. So many examples like that. People are being very, very resourceful. Thank you.
Great, thank you. I'm going to jump ahead now because we get three people as enthusiastic as you to talk about your passion and vocation, Brac, and needless to say, we've used a little bit more time at this point than we'd anticipated. So I want to jump to the message really of this to all our friends and supporters who are with us today. And I'm just going to frame it that we've got this immediate crisis, which is our capacity to respond to COVID. But as I said at the beginning, we've also got this longer crisis where the economies of our countries where we're operating are going to be under huge strain. Donor budgets are going to be under huge strain because they're, be under huge pressure to reprogram and repurpose funds. And, some of our core income sources like our microfinance businesses will also be under huge pressure because of the difficulty of those borrowing from us to repay because of the economic circumstances they find themselves in. So how, what should we ask everybody on the call today for in terms of strengthening the capacity of Brac to help the countries that we're operating in, both immediately and in the longer term? Musa, let me start with you.
Can you hear me? Yeah. So thank you. As you were hinting, that the need is enormous. At the same time, we are aware that the challenge this time world is facing is unprecedented. Every country is struggling. So when I go back and think about the 10 countries outside of Bangladesh where Brac International works, as we are at the grassroots level watching the issues, as we are at the systems level watching issues, I would summarize that we at least need 3 types of support. One, of course, financial support. Financial support for immediate term interventions, be it public health interventions, but moving from there, more importantly, we are seeing financial supports needed in terms of ensuring food security, helping with the loss at the time when the people are losing their income security. So how to really meet that up? And here, while we are partnering with local governments, as well as national governments, as well as organizations like World Food Programs, to really bring some support that need to be complemented by other support that can ensure that we are targeting right, we are making sure that right people are receiving right support. So financial support is one, both for short term, medium term, and longer term, as we move from immediate humanitarian situation to recovery to long-term rehabilitation come development. Second support we would need is partnership. This is a time when one organization, one government, one set of communities cannot work. So we need even important partnerships so that we complement each other's effort, including knowledge partnership, whereby the learning can happen together from one country can be used in other places and globally, where you can capture our collective learning and really come up with innovative solutions and low-cost solutions and locally based solutions in a way so that we can really scale those up together. So partnership is important. And third and most important, I would say, in addition to financing support and partnership support, is advocacy. I think it's extremely important that we begin to amplify the voices of the people who are struggling most. We see everybody is suffering, but we see loser of the losers. We see women and girls are suffering even within the sufferer. We see communities who are in disadvantaged position suffering even more. Who is bringing the voices of those who are in marginalized situation, in disadvantaged position? This is the time when we need to go back to them with programs like our ultra poor graduation program, which reach to the most disadvantaged people, help them lift up out of the situation. We need to really build on our program like our microfinance program, our education program, our social development programs. And we need resources, we need support. The voices of those people who are struggling need to be packaged, and advocacy needs to be done at all levels of the global system, be it national, be it international, be it global. And that needs to be in coalition together. What are the needs of the locality? That needs to be brought in there. One last thing I would say, this is a global crisis. All of us are suffering. But investment is needed everywhere. Not investing on this situation in totality would have more cost to our global communities than the cost of investment. It's better that we not only think about our own country in the north, for example. I'm talking about the friends in the north. Not only think about rebuilding your macroeconomies ending. What is needed, support other countries. Because if anything, this coronavirus outbreak taught us, that is, we are together a global civilization, global community. And our well-being depends on each other's ability to really manage our lives. It's no longer one or other. We need to be together. We'll be stronger together. So this is the time when we really need to make that advocacy that it's not just about building your own country where we know not this suffering, but global health matters. Therefore, that is another place where we need to build coalition and partnership to do advocacy.
Thank you.
Thank you very much, Musa Bhai. Hasina, could you give your thoughts on this?
Yeah, thank you. I can't agree more what Musa Bhai has said about the partnership. As in Cox's Bazar, we are in partnership with our like-minded donors, UNHCR, I must say, UNICEF, IOM, and many other, for this immediate response, like repurposing immediately the funding so that we can support the community. We are also preparing for medium term and long term. So that is, I mean, something really key. And also about coalition, like-minded organization, where people can complement each other to support those community, particularly the women and children who will be the loser of the losers, as Musa Bhai has said. I mean, the loss of education, the psychosocial support the women will be needing. We are apprehending that during these pandemic and during this lockdown and economic shutdown, right after that, perhaps the child marriage will increase in the host community. There will be a lot of other issues in the Rohingya camps. That is something we need to prepare ourselves, position ourselves to respond. Also, an advocacy. See, the challenge that we have faced in Cox's Bazar, especially in the Rohingya communities, with the mobile restriction, we cannot reach out to community through the mobile phone. We cannot do the case management, especially for the gender-based violence. We cannot actually make sure that the children who are not attending the child-friendly space and the schools right now, how are they doing, what are they doing? So those are the things I think I am looking for together with other agencies here in Cox's Bazar. Thank you.
Okay, so I'm in a moment going to ask Asif to give his thoughts, and then we'll quickly turn to questions immediately after that, which are coming racing through to me. So Asif.
I'll be very quick, Mark. I think Musa Bhai said everything that's needed, but I just want to ensure that there are economies has to be opened up sooner or later in countries like ours with a very broken economy that needs to be rebuilt. That's one side where organizations like Brac, which has a very strong grassroots microfinance arm, which is going to be a key to restart and jumpstart the economy. So that's the economic side. That's absolutely going to be crucial. But microfinance and our social enterprises, they're all getting hammered because of this economic crisis. The second side is the public health side. This COVID crisis is not going away anytime soon. This is going to stay with us for some time until the vaccine comes out. So we won't be able to shut down the economy continuously going forward. So what's going to be needed are essentially community-driven organizations like ours who are going to work with community, change behaviors, and try to enforce some of these things in a locally, culturally sensitive, contextual way, because we will need a lot of that in the coming days. So it's really, really important to support organizations like Brac, who's going to be working very closely with the governments to come together and come up and rebuild the economy, and at the same time manage this public crisis in the health side as well. Thank you.
Great. Actually, Asif, I'm going to start with a question to you first, which is not surprisingly about the a friend Richard from World Vision International has asked that one of our major challenges globally is the concern about liquidity of microfinance institutions and during the lockdown. What are your thoughts about targeted cash safety net interventions to ensure that community level financial institutions don't collapse?
Yes, absolutely. We share this concern very, very in a big way, because the longer the sort of the economy is stopped, we are gonna be cash strapped. We are on one hand paying interest to our commercial loan that we have taken on. At the same time, this is a very large force that we actually have to ensure their sustainability. But without any disbursement or collection, it's going to be increasingly difficult for us to sustain in the longer term. So for us, I think it's we are lobbying very proactively with the government to ensure that there's injection. Liquidity is going to be a crisis in the coming days for the national economy here, but I think in the governments across the world, not just in Bangladesh, has to think very carefully, because they, as I was saying, that to jumpstart the economy, microfinance institutes need to play a very, very big role, because people are going to come and ask for loan, and they're going to restart their small businesses, they restart their economic activities. So initially there will be a lot of pull for capital and cash that will be needed, and therefore the support that needs to be there. But also at the same time, we are looking at, and starting with our second phase, we are doing some of these emergency cash transfer as a grant to particularly the most hard-pressed households, so that they can sustain and survive this. And we are more and more increasingly trying to use mobile financial services so that the cash goes quickly and efficiently. And there are also a lot of learning as we speak happening in this side as well. So that's going to be a very key champion. So I think that what Musa bhai said about this advocacy, we need to advocate with the DFIs, we need to advocate with the governments to ensure that the sustainability of MFIs actually is not hampered.
Yeah. Musa bhai, what a question to you. What are the key lessons from the Ebola response that Brac is now using in its COVID response in particularly Sierra Leone and Liberia?
Excellent. So let me mention at least two. One important thing we learned, which is similar to current situation, where in Ebola, we had to go to those communities and actually work with those communities, which ended up being a kind of 7-month-long community shutdown. And we were worried that would that be possible at the time. And Brac worked very closely with the communities, figured out the way to support communities to do that, while also support communities to have access to livelihood, access to foods. And one thing we learned, that it worked. It worked, and eventually people came out of it. People came out of it, and eventually there was uptake of those interventions were there. So one thing we learned, that yes, sometimes hard-pressed public health interventions can be uptaken by the community when they realize that this is important. They make the choice. We don't make the choice. They make the choice between life and livelihood and how to balance that. Your job is to support that process and let them happen. That was one lesson we learned. Second lesson we learned, I'll be linking up with, as Asif bhai said, in that 7-month time, when we had a long period of endemic, by the way, epidemic at that time, but 7 months, I'm saying, we had to shut down 7-month period of our program operations, including microfinance operation. We had money in the hand of the people, which we distributed, but we couldn't recover. And one decision our management at the time made, that we are not going to go back to the community and say, give us the money. We rather, as well as our staff member who are in charge of that, we said, we don't ask people to return back money at this time because they're struggling with their lives. We don't ask you as field staff of Brac microfinance or Brac program to leave. You stay together. We will be trusting you, we'll be with you. That was extremely important support. The moment people began to come out of that epidemic, they paid back the money. They were asking for refinancing. You need to refinance. You don't go back and say, give money back now. You need to refinance immediately after this so that they can re-begin their businesses. You need to support that. But when we look back into that, very few, if more than 95% of the people refunded money back. We build more relationship, stronger relationship, and that can be done. So we have to be patient at this point in time with the communities, trust them, be with them, trust your staff member. And that's the lesson we learned, that it can be done. Hard public health intervention can be done, and you can trust them.
Great. Hasina, a question for you from the Lego Foundation. I understand that the Rohingya refugee population is being served with essential services, are you anticipating that this could potentially increase tension between host communities and refugee populations?
Yes, that perhaps something that we also need to take into consideration when we are thinking for long term after the COVID storm is over. A balance of the support between the Rohingya communities and the host, because the education loss is kind of equal to both the communities, but for host we still can manage with mobile checking, some sort of digital platform. But in the Rohingya, I mean, nothing at all. But however, we are thinking that we have to have an integrated approach, which we have, but we need to do a little bit of revision and redesigning of that approach in the coming months once the COVID-19 is over. And actually, I must say that the keeping the peace and stability in the communities, that is also one of the things that we need to look into consideration. As you might know that in the country response plan, that comes as one of the pillar to work in the coming days.
Let me just, we're getting close to 5 o'clock, but we're going, well, UK time, but we are going to run on a few minutes, take a few more questions, but just in case there are any people who have to leave, one thing I did just want to say is that I got an urgent message from somebody at the World Bank to remind us that Brac is qualifying for World Bank Community Connections Program, which means that donations through this channel, which is open to all World Bank staff, consultants, and retirees, are matched by the bank. And that this, because Brac has a huge number of old World Bank friends. I'm even a World Bank retiree. So it's great to know that there is that matching going on. Let me just, and we'll see how we do, but a couple more questions if we can. And Asif, for you first, how do you balance the percentage you spend on emergency response now against long-term needs, particularly when the short-term need is so compelling, but more lives may be saved in the long term?
Yeah. In essence, we are prioritizing short-term needs right now because if we are seeing starvation on the ground, and our goal is to ensure that people are not skipping meals, people are not starving as much as possible. Obviously, we have our own limitations, but we want to ensure that we do what we can in this crisis, and at the same time bring in other partners to raise the advocacy level, to raise the sort of fundraising efforts to ensure that we can use our such a large distribution channel that we have. We have mobilized the entire organization now. Everybody has stopped doing with their microfinance and all these other works that we do on a large scale and just focusing on supporting this issue. So we want to ensure that now, but in the sort of over a time frame when the economy will start to open up, we will slowly think around doing, already we have started planning, but we were going to start executing around the longer term recovery. So essentially our priority now is to save lives as much as possible.
Let me ask a similar long-term question or longer-term question, Musa, to you, which is a question which is, given the multidimensional nature of the impact of COVID-19, would holistic interventions like Brac's sort of signature ultra-poor graduation program be even more relevant now?
The answer is yes. What we see that while we are very confident that our journey towards SDG will not stop, Brac is an optimistic organization. We are committed to really do that. We'll be partner of everybody in getting there. However, we do foresee that there will be fallback. There will be fallback because of this COVID-19 outbreak. And it's so global that it is going to reverse some of the gains that we made as global community in the last several years. Be it the MDG period, the gain we made, and even the first 5 years of SDG period. There will be fallback. For example, We made an enormous progress as a global community on reducing the extreme poverty, which is linked with the SDG 1. And I see that there could be a reversal of that. Because of this COVID-19 outbreak, many of the people who are about to lead a life of growth positively, they are losing their capacity, they are losing their ability to really lead life, and even all the savings and other things, they will go back to extreme poverty again. So our signature program like ultra poor graduation actually would need to be even expanded beyond the areas where we are in, and expanded so that we can reach out more people than what we are reaching today, directly as well as indirectly through our partners, through other groups, so that we can collectively help people bring back again to the mainstream of economy. We can help them to come out of destitution again. The call is extremely important now, because in many cases we see again, it will be women, it will be people living with disability, people with disability, people who are marginalized. They will be suffering most. And our responsibility now to stand beside them most. And ultra poor graduation, microfinance event would be important. Another program I will mention, education. Kids are out of school now. They cannot lose their life. We have to go back, like Brac has its accelerated education program. We have to go there and really make sure those who are losing, how do we bring them back in the education system? Accelerated learning program, bridge education, we have to put all those together. We believe that we'll get support for doing all this kind of thing in the coming days, not only in Bangladesh, but also in the 10 countries in Africa, Asia, where the other friends from North, countries from North may lose sight of that because they're also rebuilding their country now, or will have to rebuild. But I would make an earnest request. Please don't forget Asia. Please don't forget Africa. Please don't forget the people who are living in extreme poverty or will be falling back in extreme poverty. Don't forget the kids who are there. Help them through us.
Thank you, Musa Bhai. Asif, I'm going to give you the last question to you, and it's actually again coming back to this short versus long-term issue, and it's from Sadna, and it's the following. While we're seeing the immediate effects of COVID-19 and social distancing measures on anti-poverty programs, it seems that there are second and third wave issues that will soon hit programs. Liquidity is just one of them, and other issues which we're not even yet thinking about. Can you address what you think will be some of these key issues and how we can mitigate? So the last word is yours, Asif.
Yeah, this is a long answer, but I mean, essentially because we are, as Musa Bhai said, that we are kind of slipping back a few years of gain, and with the particularly because we're gonna be right before even this started, when we were doing the 5-year Bangladesh strategy from 21 to 25, we saw that Bangladesh did enormously well in reducing poverty. So it was 20%, but about 15% was just one economic shock away from falling to extreme poverty again. And that economic shock has happened, and then some more. So so we will see a large drop of population coming back to poverty level. So that would mean there's a worry that the other issues where we had gains on, like, you know, women's empowerment and other and sort of socio-economic empowerment, those issues will get marginalized. So that's one of my worries, that everybody will get focused on so much on the economic side that the social side will get sort of lost in this. But we can't let that happen. I mean, I think, you know, ensuring when a sort of a family is in tight burden, it's always the girl's education who gets dropped, or that cost get cut the first time. So those are the things we need to be ensure that the gains that we have made over the past years, we need to continue over the coming days as well. But again, I would say that the programs like ultra poor graduation would be essentially so essential for all the countries, not just Bangladesh, to kind of bring back and give that helping hand, because essentially we are seeing a lot of our borrowers and now microfinance borrowers, they won't be able to do much with the loan at the beginning. They will need that handholding that will need to come very early days. And we are working very closely with the government now to essentially make sure that the targeting happens properly. This crisis has made that sort of opportunity come live again in Bangladesh. So I think working very closely, and this is again, I would say that because it's the last word, that again, this is a crisis that no government will be able to fight alone. And it's up to all of us, all the even private sector organizations, social sector organization. We need to sort of replicate each other's innovation that works for us. We need to support each other, and really because this is more evident than ever that one country's sort of issue now affects the rest of the world more than ever. So has been proven by this COVID-19 crisis. Thank you.
Mark, 10
you,
seconds.
Asif.
10 seconds.
Yep.
Just want to make a comment. I hope the global community has learned enough of a fact. And the fact is that not investing in strengthening health system, be it in the countries in North or be it countries in South, cost a lot. We are seeing it. Hopefully there will be investment in strengthening health system every places, be it in North America, Europe, or be it in Africa or in Asia. In that process, when building health system, before another pandemic comes, Brac can be a great partner of choice, because one of our approaches is strengthening systems by partnering with government, communities, and donors. Let's do it together.
Thank you, Musa. Look, and thank you to the three of you. I think and for wonderful presentations which just carry the whole sort of spirit of Brac in everything you say, and the passion all three of you brought to this today. And thank you obviously to everybody who spent the last 70 minutes with us. Look, this is a world where, you know, Oxfam, I think, has estimated that something like 500 million people may drop back beneath the global poverty level, where it won't just be macroeconomic measures to try and secure global liquidity, which will address that. It will be people working at the level Brac works at, trying to sew together solutions that involve local government, that involve communities, that involves Brac with its sort of innovative lesson learning loops, which kind of means that it kind of works in different cultures across different societies. And, you know, we've appealed globally for $50 million to support this phase. I have to say, I suspect over the next years, as we, you know, come under pressure ourselves, we will be appealing for more, because the work is going to grow exponentially at the very time that our funding model will inevitably come under pressure, as all of those of our partners will as well. Let me just encourage all of you to reach out to your relationship managers, your contacts in Brac about more information on our global appeal, and for any conversations you want to have about how we might repurpose funds from you that we either have or that you would like to deploy through us. I really do think in the 10 countries of Brac International, as well as in our great flagship program in Bangladesh, you know, we really are in the front line of the community development response, and before that, the humanitarian response to this astonishing global crisis that has sprung upon all of us. So with that, just take care, stay safe at home. There's no need to wish you all a safe journey home, because I expect that's where all you all are already. And thank you for not just joining us today, but being the friends and partners of Brac through good times and bad times. And I'm sure we'll look forward to many good times together again in the future. But for now, please look at our appeal and support us in any way you can as we all work together to prevail against COVID-19 and its astonishing development adverse impact. Thank you all. Bye-bye.
Thank you.
Thank you so much.
Thank you so much.
Thank you so much.
Thank you.